Hello, my name is Carol Lapointe, and this is my culminating conference presentation for the School of Public Health and Social Policy. I am completing my Bachelor of Arts degree in Health and Community Services with a global health area of focus. I would like to acknowledge with respect to the Lekwungen speaking people on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanic people whose historical relationship with the land continues to this day. I would also like to acknowledge that for my practicum, I was working on the unceded traditional territory of the Cowichan tribes. This is just a brief summary of the agenda. So this past term, I had the honor of being invited to complete my practicum with the Island Health Cowichan Valley Health and Care Plan project team in Duncan, BC, which is located in the Cowichan Valley. Though my area of focus for my program is global health, this practicum placement has provided me with an invaluable opportunity to observe, interact, and experience a healthcare project that, though on a community scale, the methodology of which could potentially be used on a larger or even international scale. The Cowichan Health and Care Plan is run concurrently with the Cowichan District Hospital Replacement Project to reduce acute inpatient bed utilization by promoting and improving community-based options and partnerships. During the Hospital Replacement Project research phase, it was determined that the new hospital would be over capacity when it opened. Therefore, once the team looked at the historical data, 4 main areas of focus were identified where current community care gaps, once improved, could have the greatest effect on acute care utilization. These 4 areas were frailty, COPD, and pulmonary rehabilitation, palliative care, and mental health and substance abuse. The methodology being that by addressing the community healthcare needs in these 4 areas of focus, in the Cowichan Valley, the unnecessary utilization of acute care beds at Cowichan District Hospital would decrease, and they would therefore not be over capacity on a regular basis. Over the span of my practicum, I was lucky enough to partake in many different parts of this huge project. From the start, my practicum supervisor, Donna, took me along to her many meetings and discussions so I could really get to know the inner workings of the project and get up to speed on where each part of the project was. Donna took time to not only explain things to me, but also the theories as to why they were doing what they were doing. It was an invaluable experience that I am truly thankful for. As part of the frailty area of focus for the Cowichan Valley Health and Care Plan, I was asked to conduct a time and motion study within the Geriatric Specialty Service Clinic, as well as with the Outpatient Wound Care Clinic. Conducting these studies and being able to be on site and interacting with the clinicians not only provided me with a chance to use the skills that I learned in my classes, but also the opportunity to see how these skills are used in a real world situation and how the data collected can be used to improve healthcare for clients and healthcare workers. I also had the pleasure of working alongside the COPD team, participating in weekly huddles, workload documentation, reorganization, caseload validation, and new process implementation. This interdisciplinary team is a wonderful group of clinicians that have made a huge impact on the COPD community in the area, and were so great to get to meet. For the palliative program, I was asked to process data collected over the past few years so that we could assess whether the interventions that were done previously had actually made a difference in hospital stays. Lena, one of the other project members that is an amazing data and research master, guided my work and taught me all about how we can use quantitative data to prove or disprove the effectiveness of a project. She was a great wealth of knowledge and a huge asset to the team. Throughout my practicum, the public health and social policy values that have guided me most were interprofessional and multidisciplinary approaches to practice and research, and community-based approaches to research and knowledge development. The Couch and Health and Care Plan requires interprofessional partnerships and collaboration for its success. Therefore, during my involvement in discussions, meetings, planning, and research, I was required to draw on these values I had learned. For example, when I was involved in the workflow and time and motion studies at the Geriatric Specialty Services Clinic, I needed to look at how the clinician worked individually and as a team to fully understand the functionality of the clinic and how effective it was for clients. Two public health and social policy knowledge areas that stood out to me during my practicum were the effective multidisciplinary teamwork and improving health and reducing health inequities in communities. I was able to observe two different clinics in Duncan that showcase these two areas. The Geriatric Specialty Services Clinic was a multidisciplinary clinic that incorporated a geriatric specialist physician, nurses, occupational therapists, geriatric psychologists, and dietitians all under one roof working together to assist the seniors in the Cowichan Valley. The outpatient wound care clinic is an important service that ensures more clients are able to be seen, which reduces wait time and increases quality of healthcare. For those in the area with complex wound care needs, time and proper care in a safe environment can mean all the difference for their health outcomes. As my call to action, truth and reconciliation, I have chosen call to action number 19. We call upon the federal government in consultation with Aboriginal peoples to establish measurable goals to identify and close the gaps in health outcomes between Aboriginal and non-Aboriginal communities, and to publish annual progress reports and assess long-term trends. Such efforts would focus on indicators such as infant mortality, maternal health, suicide, mental health, addictions, life expectancy, birth rates, infant and child health issues, chronic disease, illness and injury incidents, and the availability of appropriate health services. Two things that I will do to operationalize this call to action as a graduate will be to ensure that any and all future projects that I'm part of will be fully consulted on and supported by the First Nations communities that are involved prior to any actions being taken. Secondly, I will also ensure that these projects are effectively closing the gaps in health outcomes and not either maintaining or further increasing those gaps. One key insight that I learned over the course of the program and throughout my practicum was the value of interprofessional practice. The health benefit for not only the patient, but also the clinicians can be easily seen when visiting these types of clinics. Working together to a common goal is beneficial to everyone. A more personal insight that I like to pass on to future students would be to keep track of your class references. They're so important in your final classes assignments, but can also be used in multiple classes. The most valuable part of my practicum was probably the palliative data study that I took part in. It allowed me to use quite a few of the skills that I learned in my courses in a real world situation. As well, it gave me the opportunity to think independently about the project that I was engaged in. The only real change that I would perhaps make was that because of the timing of when I started back to school, I took a few classes sort of out of order, which looking back could have been a bit more beneficial if it had been done in the correct order, but it didn't really make too much of a difference. I didn't really have any real surprises throughout the program. However, I did find it interesting how some skills that we'd learned in class were used in real world settings. For example, some of the research skills we learned when used in context in my practicum could be used for different purposes. My proudest moment of the practicum had to be the COPD feedback study that I was able to complete prior to the end of my time in Duncan. Being able to speak to actual clients and hear about their experiences and what the program meant to their health and their quality of life was so touching and memorable. It was a pleasure to be able to see what all of their hard work had been for. As I come to the end of my program, there are a few thank yous I'd like to mention. First off, I'd like to thank all of the amazing professors and mentors that we've had these past few years. You always took the time to ensure that we were all well and understood the meaning behind the work that we were doing. I would also like to thank Jonna Joantap, my practicum supervisor at the Island Health Cowichan Valley Health and Care Plan. You always went above and beyond to teach me not only what you were doing, but why you were doing it. The experience would not have been the same without you. I'd also like to quickly thank Lena Alsakrin, the data and research master, and the rest of the CHCP team at the Norcross building. You were also very welcoming and willing to take the time to include me in your work. I appreciated every one of you. And a very quick thank you to all of my fellow students and peers for the supportive feedback every week. Even though we didn't meet in person, we made it work and we had a great time. Thank you very much.